how long do facelift results last?
For generations, a facelift has been considered a milestone procedure in your life. I recall a time when a facelift and other procedures, such as eyelid surgery and brow lifts, were done with some secrecy at a facility where the patient was admitted for days to weeks for supervised recovery. The patient would be essentially inaccessible for an extended period of time, like a month or even 3 months, before they emerged with a new look that they attributed to spending time on vacation at a health spa. We were amongst the first to make facelift procedures more accessible for people who work by performing procedures under local anesthesia with light sedation as needed and using techniques for quicker recovery and return to your normal life in about 1 to 2 weeks. As opposed to prior generations when these procedures were performed when you were in your late 60s and older, I helped people who were in their 50s improve their appearance of their cheeks, jawline, and neck with less aggressive but comparably effective facelift procedures so they can look their best. Naturally, a question that comes up is, how long will my facelift last? The benefits of a facelift procedure are predicated on your natural aging characterized by bone and soft tissue loss as well as loss of collagen in your skin. We also need to factor in stresses to the body, such as emotional stress, medical events, diet and nutrition, as well as social activities such as smoking, excess alcohol consumption, and excess sun exposure. Some doctors will claim to perform procedures which are deeper and implying superior near-term results as well as longevity. Published peer-reviewed studies have shown different techniques to be comparable and that there is no one way to get the best results. There are key aspects of any facelift procedure that's critical for a successful outcome, such as addressing the layer of support tissue under the skin called the SMAS. The word SMAS stands for the superficial musculoaponeurotic system, essentially what transfers the action of your deeper facial muscles to your skin. This layer is commonly referred to as the muscle, used in phrases during consultation, such as, "Are you going to tighten the muscle?" Performing facelift surgery is an art with multiple aspects of the procedure. When I perform a facelift, it's done by feel, which comes from experience. For example, the amount of tension applied to the skin and the way excess skin is trimmed is in a way comparable to being a tailor. Factoring in the age you are when you have a facelift, the expected longevity of benefits can be estimated to be about 5 to 10 years. Does that mean that every 5 to 10 years you need to do another facelift? Not necessarily. A lot of people come for consultation for a facelift years after their prior facelift procedure was performed, for example, by another surgeon. I often find that their perception of needing another facelift can actually be addressed non-surgically. Recognizing that bone and soft tissue loss can make the skin appear to have become more loose with time. The irony here is that performing a facelift can have limited benefit since there is less bone structure to provide your skin optimal support. Using my experience performing facial implant surgery, I place hyaluronic acid fillers at the bone level, which we call structural volumizing. This approach allows me to create definition instead of a soft, doughy appearance often seen with conventional filler placement methods. I typically use thicker hyaluronic acid fillers like Juvederm Ultra Plus and Juvederm Voluma with results lasting 1 to 2 years.